So in Canada, we have what I think is kind of a peculiar system. We fund hospitals and physicians under a universal program that covers everybody in the country and for the full amount of the cost for medically necessary services. In contrast to that, we have a real patchwork of coverage for prescription drugs. So whether and how generous your coverage is depends on what province you live in, whether or not you have an employer-sponsored health plan, and whether or not you qualify for the public program. So if you are self-employed, for example, you're not going to have a whole lot of drug coverage available to you generally because it's tough to buy insurance on the individual market, and you're probably going to have an income level that's high enough that you're not going to qualify for public plans. This leaves Canadians paying a lot out of their own pockets, and those out-of-pocket costs have consequences for people. The consequence of those out-of-pocket costs is that people can't afford to take their prescription drugs. So when we looked at this across Canada, we found that 1 in 10 Canadians actually can't afford all the drugs that they've been prescribed by a physician because of the cost. So they're either not filling, not refilling, or choosing to do something like split pills to make their prescriptions last longer because of cost. There's lots of reasons you might want to see people not adhere to a drug, if the side effects are bad, if it's not working, but cost I don't think is one of them. It also could have consequences for the health system further down the line. If somebody isn't taking their antihypertensive or their medicine to lower their cholesterol, clearly that can't help them prevent other events that would be fully covered. Like if somebody has a heart attack as a result of that, that's going to be fully picked up by the public tab.